Welcome to the Riverbend Awareness Project.
The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
I've heard sometimes after someone has a stroke, their personality might be slightly different. Is there anything you can say to that, or also other effects that the strokes might have on somebody's, not only their physical health, but also their mental health?
So in regards to the physical, we'll have that weakness. They can cause problems with their speech, depending on where the stroke is. With mental, they can have a change in personality depending on where the stroke is. A lot of times they can have depression, anxiety, because even if their symptoms were mild and they can go back to work, or try to go back to life as we know it, it's still, oh my gosh, it's still, don't record that. It still can affect their mood and their personality. Some can get, there's a lot of fatigue too after a stroke. A person can stay fatigued for weeks. And if it continues, then, they can talk to their doctor about ways to treat that. But the fatigue is huge. Depression, anxiety, sometimes there's this thing called pseudobulbar affect, and it affects the part of the brain, or the part of the brain that kind of controls our emotions. If that's affected, people can develop that. And what that is, it's not a personality thing. It is a physical thing from the stroke, but the person can have really rapid mood swings. They can start laughing uncontrollably for no reason, or inappropriate times, or start crying really easily. And it's kind of like a reflex, like when someone gets the hiccups. So, kind of being supportive, asking them what you can do, because trying to tell them, stop crying, that doesn't work. It's just that little reflexive part of their brain. So that can happen. Memory loss, they can have short-term memory loss. They can have a hard time remembering certain steps, like completing a task. Sometimes they might forget how to run a microwave. They might not remember names of some of the people that they know. They can have because of the confusion still after the stroke. So those are a lot of the things that can happen after stroke. Let me just take a peek to make sure. Yeah. With physical too, there's potential of having seizures.
After the fact?
Yeah.
Okay.
Seizures. And then spasticity can happen too, like the arm or leg that's affected, where just the muscles just tense up and makes it harder for movement. So being able to work with therapies and trying to get that movement back is really important. Let's see. Oh, yeah. They can patients can get confused and angry and careless, depending on where their stroke is. Sometimes they'll lose. Some might lose that filter that we're supposed to have. Some patients or some survivors have had times where they've said that, I used to be a lot meaner or more intolerant before my stroke, or some people it's been the other way around. They become, spouses or caregivers have noticed that the survivor is a little more irritable and cranky when they weren't before. So it's just really different depending on what part of the brain is affected.
You kind of touched on it a little bit, but like, what can friends and family do to help someone who's had a stroke, like, recover and then adjust to whatever their new normal looks like?
Yep, their new normal. So in regards to caregivers, being aware of, the stroke and the potential outcomes that can happen, like being aware of the moods, being supportive, taking care of themselves. The caregivers really needs to take care of themselves. They won't be any good for the survivor or themselves. So that's huge. Looking for any resources or support out there to be able to talk to someone and know that they're not alone.
So it's a life-changing event for the patient. It's also a life-changing event for family and friends. It affects everybody. And so patience on understanding, trying to learn that new normal, what that new normal is and how that new normal is going to be. And, I've had family members that have had strokes, and my grandmother, her speech was so off that as a child, I could never understand what she was saying, but her children through time got to understand and they could understand what she was saying. But, the difficulty in that and understand the frustration. I can see their frustration in their eyes because they want to say something, they want to know, or they know what they want to say, and every time something comes out, it's not that. So it has to be incredibly frustrating.
So if somebody has had one stroke, then are they more susceptible to having a second stroke? And are there things that they can do to be proactive in preventing that?
So yes, you're about 30% chance. Okay, it goes up significantly if you've had one stroke. Now, how you prevent that is, well, a lot of the things. We take care of your blood pressure, take care of your cholesterol, your hyperlipidemia medication. It may be an aspirin a day, every day for the rest of your life. It may be dual antiplatelet therapy, so we have that in addition to a prescription medication that you take that help keep the platelets from sticking together and forming clots. Weight, exercise, moderation, not using illegal drugs, taking medications for your heart rhythms if you have that. If you have one of those cardiac structural abnormalities I talk about, there's ways to go in and plug those that they can do it in the interventional cath lab also.
Diabetes, controlling, even a diabetic who actually controls their sugars at baseline already have like a 25% chance of having a stroke. So really controlling those blood sugars helps prevent a stroke.
You talked about your guys's, or not, I should say your guys's. Sorry, words. You mentioned the support group that you guys are a part of, that you're facilitators of. How did that get started, and how have you seen it affect people's lives to have that support and community?
So we wanted to start a support group because there's a need. Because, like Jim said, the stroke is life-changing. And so knowing that there's support and somebody to talk to who's gone through the same things or is struggling with the same issues. And so Dr. Dixon, who Jim talked about earlier, he had a stroke support group. But when COVID hit, nobody was meeting anymore. So we kind of spoke with him, and we decided to start the support group again. And he's a big part of it as well.
Part of the goal behind this is that we have some educational topics. We will bring in therapy services, so there'll be a physical therapy one time, occupational, speech. Our social service department has been a great big help to us. Having Dr. Dixon there, some of it's peer support. People that have had strokes or going through similar things, they can talk to each other. We're also a support group for the caregivers. And so that the caregivers can talk and understand and learn things that they can do to help, but also talk to other caregivers and talk about the frustrations, the difficulties, what's working for them, how they're supporting, and those things.
Thank you for providing that resource.
Thanks.
Are there any other misconceptions or myths surrounding strokes?
There are. Again, one of those, the first one I talked about was that it only affects the elderly. It can affect anybody in any age group. We've taken care of children, young children that have had strokes, teenagers, all the way up and through the adulthood. So it does really affect all age groups. The fact that it will always cause paralysis or severe disability on one side of the body, not always true. If you have a posterior stroke, you may have problems with balance and dizziness and nausea from that or those things. Or if it affects your vision, and you can actually stroke just your eye and lose complete vision in just the eye. So those things, strokes are painful. They're usually not painful. They're more annoying type symptoms that you have. Why can't I pick up my coffee cup and take a drink? Why can't I hold anything? Why do I keep dropping things? Why do I keep drooling out of the side of my mouth? Those type of things, or the fatigue, some of those. And that's why if you don't have, those classic symptoms of real facial droop and real big weakness, people go to sleep and think, I'm just tired. I'll wake up in a couple hours, I'll be fine. And they wake up and they're not fine. The recovery only happens soon after the stroke. Recovery is a continued process, and you can continue to recover. You have this neuroplasticity in your brain, and when there's a damaged area, other parts of the brain can start to pick up some of the functions that damaged piece used to do. And so that's an evolution. And a lot of that's repetitive type physical therapy, occupational therapy, speech therapy. The more you do it, the more you're going to get back.
And the neuroplasticity is usually happens most in the first 3 months after the stroke. So that's why the importance of really working with rehabilitation and the therapies to try to gain back as much function as the survivor can.
Strokes aren't preventable. Yeah, they are preventable. And strokes are like heart attacks. Heart attacks affect the heart. Strokes affect the brain. The risk factors are similar. However, what happens to you if you have a heart attack is significantly different than what happens to you if you have a stroke.
They're connected, but they're not the same.
Correct.
Yeah. I think that's so cool that the brain can find different pathways. That's super hopeful, I feel like, in knowing that okay, there are parts of the brain that are damaged, and that damage doesn't repair itself, I'm assuming, right?
Correct.
That stays damaged, but the other parts of the brain can make up for it. I don't know. That's super cool.
Yes.
Is there any recent discoveries or innovations in either discovering how to treat strokes or how to help people after the effects?
So, there's there are a lot of clinical trials going on right now trying to look at like possibly expanding that 4.5-hour window, seeing if it's safe to go like out to 6 hours with giving the medication. There's been research about different, like, they've looked into stem cells. There's things like a vagal nerve stimulator, which is implanted, which can help like with arm weakness and stuff. That isn't happening around here. If anybody gets one of those, they'd have to probably go to the U. But there's like some exoskeleton kind of robotic stuff that's been developed to try to help people with their movement. So we're still learning, still trying to find new things to help people.
What would you, I guess if you had like, what's the most important thing you kind of want people to know about strokes and how they affect people's lives?
Recognizing the symptoms and not waiting. That is huge. Or like having the symptoms and they go away. They still need to be looked at, but just being aware of the symptoms. And there's a large percentage of strokes that can be prevented if we would, work on the risk factors, getting that blood pressure down, becoming a little more physically active. In regards to physical activity, even walking around the block, every couple hours when it's nice outside, or parking further away so you can walk a little further when you're going into the store. Changes to eating habits to kind of help with the weight, but also helping with cholesterol. Just being aware of your risks, knowing your risk factors, talking to your provider, if you're worried about some of your risk factors, and just taking care of yourself, basically.
Yeah. And recognizing those symptoms in others. You recognizing the symptoms yourself if you're having them, but others being aware and recognizing those symptoms. And also encouraging. We live in an area where people are extremely independent and very tough and very stoic. And that causes delays in this care. I'll shake it off. I'll rub some dirt in it. I'm fine. And then after a while, they realize, oh, I'm not so fine. And that delay hurts them more. Just seek help. Call 911.
I feel like I can be guilty of that. Like other people, I'm like, yeah, no, something's happening. I'm like, you should go get help. And I'm like, something happens to me. I'm like, I'm fine. I don't need help. I'm like, no, that's not how it works. You gotta seek. I like that. Seek help. Is there anything else that we didn't cover that you guys wanted to talk about?
We talked about risk factors, recognizing the symptoms, being aware of the not so normal symptoms in regards to the fast, with the balance and the dizziness and the vision. A lot of times they can have like sudden onset of dizziness and vomiting. And if it's a sudden onset with like the confusion or the vision changes or that dizziness and vomiting, if it's pretty sudden, then, seek help. And then too, just, when people get headaches, if it's a terrible headache, the worst headache of my life, go in and seek treatment. Because even though hemorrhagic strokes don't happen very often, they can be really devastating as well, depending on where, if it's affecting the arteries or if it's affecting the smaller blood vessels inside the brain. So seeking help, especially for those, is really important to get call 911 and get taken care of.
They call it also, so worst headache of my life, a thunderclap headache. So kind of like, thunder went off and in there. And some people can actually, in one particular type of stroke, actually hear or feel a pop. And so that's actually in Wyoming, had a physician that called the hospital and said, I just had a subarachnoid stroke. I'm coming in. Please get air on the way, because they had to fly to Utah. And he was on a treadmill and actually felt the pop and knew what it was.
Tense.
That is. Thank you both so much for coming in and for sharing your knowledge and for everything that you do for the community as well.
I'm super grateful.
Thank you so much for having us.
Yes.
We're glad to. That's the whole point of this podcast, is to spread awareness and about important things. And I think everyone knowing a little bit of knowledge about how you can help your fellow humans is pretty good. So
we agree.
Yes.
If you would like to listen to the Riverbend Awareness, you can find it anywhere you get podcasts or on the Riverbend Media Group podcast page. Please share it and subscribe. Get all that awareness information out there.